Interventional radiology is an exciting specialty. We use imaging guidance of CT scan, MRI scans, and fluoroscopy and ultrasound to see inside the body and operate inside the body. So these surgeries are less expensive and sometimes can replace the surgery with better outcomes for the patient. So we need a lot of them in India to treat patients. There are only a few interventional radiologists in India being trained at big institutions, but many of the small towns do not have enough interventional radiologists to cater to the population. So our aim with this program is to train a lot more interventional radiologists in India through a combination of simulation and outpatient training at multiple institutions to increase the number of people who could serve at small towns and rural areas. And Raj is a great fan about it. I'm very happy to be part of it, and we'll work together to make this a great success.
Thank you very much. It's not new, but it is growing topic. So the diagnostic radiology, which is doing a scan and providing a report, is to tell what's wrong with the patient. But interventional radiology will help treating the patient. So interventional radiology basically involves treating conditions using procedures like drainages and biopsies that are done through the skin, but also doing a lot of vascular procedures like angioplasty, stent placement, etc. And also some of the cancers are now being treated by radiologists. So again, we are fortunate to have Professor Sanjeeva Kalwa, who is the head of interventional radiology in Mass General Hospital in Boston, and another professor at Harvard Medical School. So he will talk about the interventional program that we're about to start. It's not new, but it is growing topic. So the diagnostic radiology, which is doing a scan and providing a report, is to tell what's wrong with the patient. But interventional radiology will help treating the patient. So interventional radiology basically involves treating conditions using procedures like drainages and biopsies that are done through the skin, but also doing a lot of vascular procedures like angioplasty, stent placement, etc. And also some of the cancers are now being treated by radiologists. So again, we are fortunate to have Professor Sanjeeva Kalwa, who is the head of interventional radiology in Mass General Hospital in Boston, and another professor at Harvard Medical School. So he will talk about the interventional program that we're about to start.
Just to add to that, I think you can see the evolution of radiology and radiologists over the years. So like one difference, say in UK or in England where I work, is that I hardly do any scans. So sonographers can do the ultrasounds, CT radiographers do the CT, MR radiographers do the radio. So my main job, if you look at my work, is most of it is interacting with clinicians, is to hear the patient story, the clinical problems, and then interpret the radiology in line with that to give them advice. And as Raju said, that is the main focus going to be. So radiology is not going to be replaced by AI. I think whenever new technology comes, we all feel threatened that something is going to get lost. But I think the trick is to imbibe the new technology and enhance the service you offer. And I think AI will settle down, will have its role. And as Raju said, it will do a lot of the manual work that we spend a lot of time. And we will add more value to the service by interacting with the clinicians and making it different for the patient.
Does anybody have any?
So what is it?
When I started my training, we used to have 20 images from the CT scan to look at. Now, on an average, our CT scan contains, roughly about 2,600 images. And so you can imagine that there is a lot of data that we have to sniff through.
Yeah.
And where AI really helps is in terms of collating that data and providing it to us so that we make the best educated guess. I'll give you a simple example. If I tell you I have a statement that I have a test that can diagnose every single patient with cancer, and it's called the nose test. If you have a nose, you have a cancer. I will be right 100% of the time, right? But I will also be wrong many times because many patients with nose don't have cancer. And that is the value of AI. It brings in what we call sensitivity, and the radiologist's knowledge helps with the specificity. And the balance is what is needed. It's, as Raju alluded to, Dr. Raju alluded to, it's going to help us be better radiologists to sniff through the large data and provide the information. It's not going to replace the person who made the statement 10 years ago. I won't tell you who that person was. When he required his scans to be read, it was read by us at MGH. So you can imagine that it's not going to work. We are not going
Yeah,
to
of course. I mean, I understand that human intervention is very important. Yet, that was your society which, expressed concerns. So I was asking.
Absolutely. Thank you. That was very useful.
Thank you. I just
About today's qualitative shortage and how we're going to address that. The quantitative shortage, which is not having enough number of radiologists, clearly that's not something we can easily influence. That depends on the number of departments available to train. But again, I think what AI can do is to reduce the amount of time a radiology spends on a report. So hopefully that will help people to get through more volumes of cases. But the shortage has to be addressed. It's a global problem, not just in India. It's there in the US and the UK. So we do need more radiologists, and technology can go some way in helping that shortage.
Really, I would like to know which area of radiology requires highest amount of skill and where chances of error are more. My second question is, in the modern radiology, what are the safety mechanisms for radiologists as well as patient exposing repeatedly to the radiation?
related to that, I mean, when he was talking about the second question, I just want to add to that. In the times of deep, what do you call it? You have this the threat of data being stolen. What is that called? Deep intelligence.
Deep fake.
Deep fake. Yeah. Sorry. So in times of deep fake, how do you really ensure that the data is secure? So that was related to that.
There are 2-3 topics here, so I'll ask my colleagues to answer. I think Sanjeeva can probably answer the radiation side of things better, and then maybe Dave, do you want to comment on the errors and what are the areas where the most errors could happen?
I've been out of practice 5 or 6 years, so maybe that's an excuse, but no. Certainly in the UK, you have audit meetings, and your errors are published and discussed in a frank and open manner, and that's how it should be. Clearly, if there are any lessons to be learnt, they are fed back in an organised way to any department. Now, I can't talk about Indian radiology, and I'm sure somebody could comment on that, but certainly that's the way forward. We have clinical governance, which should hopefully we learn from our mistakes, and that's the most important thing. One of the questions was, well, which bit of radiology it makes the most mistakes? I would say every part of radiology. If you don't make mistakes, you're not doing enough work, basically. All right. But clearly, we need to minimise our mistakes, and hence education is extremely important, and governance is extremely important. And I think that comes back also maybe to to your question about data as well. Every single company, every single institution is worried about data protection, and I think that's a huge issue in today's world. I'll stop there.
I'll just answer that question a little bit more, like what is the current practice and how do we address error and patient harm, not only in radiology, but all aspects of medical care. Now, one thing is true, all of us make mistakes. And if anybody tells you that I don't make any mistakes, it is like, having a drink and not getting drunk. You either don't drink or you are lying. So the problem is that when mistakes are inevitable, how do you reduce it? And more importantly, how do you learn from it? So in UK, what we have got is something called, we have stopped pointing fingers and accusing people. So like every month in my department, we will look at most cases that mistakes have been made, and with an anonymous, threatening way, we'll discuss those mistakes, and then we'll collect the findings and distribute it to all the radiologists that everybody can learn. Now in UK there is another huge change which has come in. There is a committee called REAL committee, which is again real understanding and learning from errors and mistakes. And the person who leads that program is one of my friend called Dr. John Smith, who runs it. And I think that it is very important, as you said, as the lady said, that this should be a fabric or part of teaching radiologists and training them to not shy away from the fact that we make mistakes, but to learn from it. So as part of the GRTP 2-year course program, this is one of the elements I want to teach our radiologists here as well, is how to look at your own error rate, how to look at your own mistakes, how to learn from it, and do it in an open manner, not hiding things anymore. So I'm expecting that Dr. Smith will come here to give the talk and talk to the trainees here that will come to the GRTP program. Because I think apart from learning and training, learning from mistakes is as important.
So there are two more questions. I think one is about data. So I think Agash and Dave mentioned data security. We take it very seriously. There are international regulations like the GDPR in the UK and Europe and HIPAA in the US that we try to comply with. There's one more question about radiation. Do you want to say anything?
Yeah, I mean, protecting your patient from the maximum radiation is
Consultant pediatric radiologist in Oxford, and I've also been heavily involved with the Royal College. तो मैं ये जो तजुर्बा मुझे मिला है इन सालों 20 साल काम करने, रेडियोलॉजी ट्रेनिंग तैयार करने, एग्ज़ाम्स करने के लिए, तो मैं इंडियन हूँ। मैं चाहता हूँ कि मैं इंडिया वापस आके कुछ करूँ कि यहाँ का जो देश के जो लोग हैं, जो पेशेंट्स हैं, बच्चे हैं, उनको कुछ फ़र्क हो सकता है। अभी मैं मेरा लाइफ के ये स्टेज में हूँ, मुझे ज़्यादा पैसा नहीं चाहिए, पोजीशंस नहीं चाहिए। आई जस्ट वांट टू डू इट बिकॉज मुझे अच्छा लगता है ये करने में। एंड मैं जो ट्रेनिंग का चेंज कर चुका हूँ यूके में, इंग्लैंड में, स्कॉटलैंड में, वो मैं यहाँ भी कर सकता हूँ, क्योंकि बच्चे जो इंडिया का है वो किसी तरह से डिफरेंट नहीं है यूके के बच्चे में। जो पेशेंट्स आप हैं, आपका डिजीज़ कुछ डिफरेंट नहीं है यूके, इंग्लैंड का, स्कॉटलैंड का पेशेंट्स, अमेरिका पेशेंट्स। तो अगर हम लोग का जो कुछ कर सकता हूँ जिसमें कुछ तरक्की हो, यहाँ का लोग का कुछ भला हो, वही है। तो मैं क्या कर सकता हूँ? मैं तो सबको ट्रीट नहीं कर सकता हूँ, बट मैं ट्रेन कर सकता हूँ। मैं रेडियोलॉजिस्ट को ट्रेन कर सकता हूँ कि वो अच्छे रेडियोलॉजिस्ट बने, सिर्फ पैसा नहीं कमाएं, बट पेशेंट की भी भलाई करें। एंड वही है हमारे एम, कि अगर कुछ कर सकते हैं, ट्रेन कर सकते हैं, इंस्पायर कर सकते हैं कि वो लोग गांव में, अपने छोटे छोटे टाउन में, अपनी जगह जाए, कि वही एक्सपीरियंस, वही नॉलेज लेके कुछ डिफरेंस कर सके पेशेंट को। अगर 100 भी कर सकता हूँ वो मेरे लिए काफ़ी है, हज़ारों होगा तो एकदम बहुत ही बेहतर होगा। तो यही है, मैं मेरा वर्किंग लाइफ को जो लास्ट 5-10 साल से बचा हुआ है, वो आई वांट टू स्पेंड हियर एंड ट्राई टू मेक अ डिफरेंस। आई एम नॉट अगेंस्ट एनी, देयर आर लॉट ऑफ गुड टीचर्स, देयर आर लॉट ऑफ गुड इंस्टीट्यूशंस, उससे मेरा कुछ प्रॉब्लम नहीं है। हम लोग जो कर रहे हैं वो लोग जैसे ट्रेन करते हैं बहुत अच्छे करते हैं, बट हम लोग और भी थोड़ा कुछ कर सकते हैं उनको हेल्प करके। वही है हमारा एम एंड होपफुली वी विल सक्सीड। जीआरटीपी जो रेडियोलॉजी ट्रेनिंग जो है, आप अगर देखिए क्या ट्रेनिंग होता है, लाइक हमारे इंग्लैंड में कैसा ट्रेनिंग होता है, उसमें फर्स्ट ईयर जो ट्रेनिंग होता है, जो रेडियोलॉजिस्ट को समझाता है कि एनाटॉमी कैसा है, फिजिक्स कैसा है, बट सेकेंड ईयर एंड थर्ड ईयर ट्रेनिंग वो सबसे इम्पोर्टेंट ट्रेनिंग है। वो ट्रेनिंग बनाता है एक रेडियोलॉजिस्ट को कि वो सब कुछ स्कैन्स देख सकता है, सब तरह का पेशेंट्स को ट्रीट कर सकता है, एंड उसके बाद वो स्पेशलिटी करते हैं। तो इंडिया का बात सोच के मुझे लगता है कि सबसे ज़रूरत जो है वो जनरल ट्रेनिंग जो है, कोर ट्रेनिंग, उसको करना, कि आप अगर एक अच्छा रेडियोलॉजिस्ट बने उसके बाद तो आप स्पेशलिटी कर सकते हैं ना। आपको अगर खाना बनाना नहीं आता है तो आप तो जाके पहले बिरयानी नहीं बनाएंगे ना, आपको दाल चावल रोटी बनाना सीखना पड़ेगा, उसके बाद ही आप अच्छे चीज़ बना सकते हैं। रेडियोलॉजी ट्रेनिंग भी वैसा है, आपको पहले एक जनरल रेडियोलॉजिस्ट बनना है, उसके बाद आप जाके तरक्की करें, आप स्पेशलिटी करिए। तो मेरा एम है कि वो जनरल रेडियोलॉजी ट्रेनिंग एकदम अच्छी तरह से करनी, तो इसीलिए मैं ये 2 ईयर जीआरटीपी प्रोग्राम स्टार्ट करने का कोशिश कर रहा हूँ। उसमें जो करिकुलम है वो इंटरनेशनल करिकुलम है,
एंड जो टीचर्स जो हैं वो सारे दुनिया से हम लोग ले आए हैं, हार्वर्ड से, ऑक्सफोर्ड से, मिडल ईस्ट से, जो सबसे बेहतर है इस स्पेशलिटी में, वो आके हम लोग को हेल्प कर रहा है। क्यों हेल्प कर रहे हैं? क्यों? एक दो छोड़ के बाकी सब हमारे जैसे इंडियन हैं, वो दुनिया के सारे जगह जाके अपने नाम कमाए हैं, पैसे कमाए हैं, वर्ल्ड फेमस हो गए हैं। बट हमारे सबका ही एक कॉमन चीज़ है कि हम लोग इंडियन हैं, तो हम लोग फिर आके कुछ इंडिया का तरक्की भी कर सकते हैं। हम लोग तो अपने नाम तो कर लिख चुके हैं, वो तो हो चुका है, बट अभी जो है हम लोग अगर कुछ कर सकते हैं इधर, वो बहुत अच्छा होगा। एंड इसीलिए वो लोग हमारे GRTP प्रोग्राम में ज्वाइन किए हैं। एंड ये जो 2 ईयर प्रोग्राम है, हम लोग का कोशिश है कि ये एकदम वर्ल्ड क्लास ट्रेनिंग हो, कि एक रेडियोलॉजी ट्रेनिंग यहाँ वो अमेरिका, ऑक्सफोर्ड, कैम्ब्रिज नहीं जाना पड़ेगा। अमेरिका, ऑक्सफोर्ड, कैम्ब्रिज घर पे आ रहा है आपको ट्रेनिंग करने के लिए। और हम लोग चाहते हैं कि ये बहुत अफोर्डेबल, कुछ तो खर्चा है ही जो हमारे ये पूरा ट्रेनिंग को ऑर्गेनाइज करना है, बट हम लोग इसमें से ज़्यादा प्रॉफिट नहीं बनाने की कोशिश कर रहे हैं। बट यही हमारे कोशिश है कि ये 2 ईयर प्रोग्राम होगा फाउंडेशन ऑफ गुड रेडियोलॉजिस्ट। आफ्टर दैट हम लोग ये मिनी फेलोशिप प्रोग्राम करें, वो स्पेशलिटी की भी आपकी पॉसिबिलिटी है। बट मेरा ख्याल से सबसे इम्पॉर्टेंट जो है ये 2 ईयर GRTP फाउंडेशन, दैट इज़ द वन विच इज़ मोस्ट इम्पॉर्टेंट। एंड मेरा जितना भी एक्सपीरियंस हो, मेरा जितना भी नॉलेज हो, मैं वो सब यूज़ करके इंडिया में हम लोग ऐसा प्रोग्राम बनाने की कोशिश कर रहे हैं कि दुनिया में कहीं भी नहीं है, ये इंग्लैंड में भी नहीं है, अमेरिका में भी नहीं है। तो हम लोग वो कोशिश कर रहे हैं इंडिया में करने। एंड यही मेरा अभी जब बोलते हैं ना मिसाल है कि मैं इसे सक्सेसफुल करके रहूँगा।
Thank you so much.